Hey guys, Coach JJ here, aka Joanne Voorhees Collins, your board certified health and wellness coach and public health educator coming at you today. I hope that you all are having a wonderful day. You can, in the comments below on the YouTube video or in the Facebook post, place a comment about where you're from, and certainly if you have any questions that you'd like me to answer, please go ahead and post those down in the comments below. So, I have to make a couple of disclaimers. Number one, I apologize for any extraneous noise. I am sitting outside on my deck in my lovely wilderness woods on a beautiful, bright and sunny 75-degree day. And I take every opportunity I can to sit outside just because I need the sunshine and the fresh air and everything. And I would encourage you all to do that as well. Okay, so that disclaimer's out the way. Second disclaimer, nothing I say in today's lecture should be misconstrued as a substitution for or direct medical advice at all whatsoever. These are just comments that I know from research that I've read from the governing bodies for medicine, personal reports I've heard, and my own personal scientific opinion. Don't misconstrue any of this as advice. Suggestions perhaps for you to consider, but always talk to your doctor or any other healthcare provider that will be dealing with you about anything that you have concerns about. So today I wanted to talk about what does it mean when you find a blood sugar anomaly, and why do providers say different things to different patients? So we're going to start with the first one. What is a blood sugar anomaly? The word anomaly means something that deviates from the standard, deviates from what's expected. And so in the case of diabetes, when we have a blood sugar anomaly, it's a situation where we've had a pretty stable and steady blood sugar level range. We don't have any big concerns. We're not flip-flopping back and forth. We're kind of even and steady, and we kind of know what we do when we do it. And so the anomaly would be, we're trucking right along, and then beep, super high blood sugar or super low blood sugar. Okay, so that would be an anomaly. And I am bringing this up because this was an issue that occurred with one of my clients this morning, actually. And that client is very gracious to allow me to share her story about what happened and kind of walk you guys through it, sort of like a case study. And this is especially applicable to people who are type 1.5 diabetics and people who are on insulin. It applies to everybody, but definitely extra important for those two groups of people. So my client had been following a very strict, I don't want to say very strict, but strict food plan that she created herself, knowing what seems to work for her and what doesn't. So it wasn't exactly like, like a doctor prescribed plan or something like that. It was, she had spent some time testing herself and figuring out this food works for me, this one doesn't, kind of narrowing things down, and figured out a definite set of foods that she knows works for her every time. And doing that for herself, she's actually lost 13 pounds since she got started with this, and she's only been doing it for I think just about 3 weeks maybe. Her blood sugar had not been over 125, which is fantastically amazing. But this morning, the blood sugar went up to 138 from 91. And so it went from 91 to 138 at right around that 2-hour mark. And she was very concerned. And so I know a lot of you are going to be sitting there thinking, well, but it's just 138. Why would you even be concerned about that? That's fantastic. And generally, the governing bodies that set sort of the standard of care and policy with regard to blood sugar ranges they would say, oh yeah, no, that's great, that's fine, doing fantastic. But she was concerned. And so you're probably wondering, well, why was she concerned? Number one, because she had an entire over 2 weeks of not being above 125, and then she went to 138. So there's a question of, well, why would that have happened? She's in the process of trying to rule out foods that are not good for her body. And as y'all have heard me, if any of y'all have followed me for any sort of time, y'all know that I will say this is not a one-size-fits-all. What's good for the goose is not always good for the gander. I might be able to eat an apple and peanut butter and like not budge on the blood sugar, and then, you know, Susie, Beth, Kim, Sue, Donna, Bob, Joe down the street will look at an apple and skyrocket the blood sugar. So what works for you may not work for me, vice versa. And so that's why it's important for us to try to test ourselves and try to rule out foods that it's like, no, my body clearly cannot process that. It doesn't like it for whatever reason, makes my blood sugar go up, or I feel bad after I eat it or whatever. That's going to go on my no list. And then there's other foods that can go on your moderate list. Like, well, I know if I have a little bit of this, it won't bother me. But if I have all of the things, then I'm setting myself up for trouble. And then you have the safe list of like, I know if I eat these meals or these ingredients, these things, I don't really see a big giant effect in my blood sugar. But the third reason to be concerned about this is especially when it comes to people who are type 1.5 or people who are taking short-acting insulin. When you're taking insulin, as a lot of 1.5 type people are, and a lot of type 2 actually also are taking insulin, you got to be checking the blood sugar, because that's how you're going to know if you need like a correction dose or something like that. So those are the three primary reasons to be concerned when you see an anomaly, especially when the blood sugar goes up. If the blood sugar comes down significantly, then you have to look at what's your nutrition status in terms of how much you've eaten. Are you hydrated enough? Are you coming down with something? What time did you take your medicine? What's the dose of your medication? And you might need to speak to your healthcare provider about adjusting the time or the dose, or maybe you take it before you eat, or maybe you're supposed to take it after you eat. Only you and your provider can work that part out, but you have to start, paying attention to this stuff. And so, again, you still might be thinking, well, why does it matter if it was just 138? We went from 91 to 138 at the 2-hour mark. That's a 47-point increase over just having a little bit of a new food item that we were trying. And so that actually technically qualifies as a spike, even though we didn't go over the standardized parameters from the American Diabetes Association. It's still considered to be a significant increase. Most of the governing bodies out there say that if you see 40 points or more 2 hours after you eat a meal, and it hasn't come back down, then that's an that's considered to be a spike. And some people, depending on their metabolism, and if they have conditions that slow down their digestion and things like that, they could actually continue to see a rise at the 3-hour mark, at the 4-hour mark. And for people who have severe digestive issues, things like gastroparesis or Barrett's esophagus or Crohn's disease or a number of things like that, even at the 5-hour mark, that could be when you finally peak, because the digestion has been slowed down because of the disease or the medications you're taking or whatever. So it's important that we understand these potential contributing factors. You may have some of them yourself. Just a quick reminder about blood sugar parameters, normal non-diabetic blood sugar is between 70 to 100 first thing after you get up, after at least 8 hours of rest and no food. That's 70 to 100 at that time. And they say fasting blood sugar, they say morning blood sugar. Well, it ain't morning for everybody. Some people work second shift, third shift, whatever. So, your 7 o'clock is their, 11 o'clock or their 2 o'clock or whatever. So just that period of at least 8 hours of like rest and no food. After eating at the 2-hour mark, normal blood sugar should not be above 140. According to all of the governing bodies, CDC, National Health Institute, American Diabetes Association, American Medical Association, like all of the governing bodies agree that if you're non-diabetic, or if you're considered to be within normal range, you're not going above 140. I kind of wonder about that some, but I'm not a physician, so they know better than I do. Maybe. I think. When you have diabetes, many of these associations, like the Diabetes Association and stuff like that, they say that it's okay, like they consider it to be acceptable if your blood sugar is less than 125 in the morning when you wake up, and if it's less than 180 2 hours after eating. There is some disagreement within the diabetic community about that range, and you will find that some doctors, that's what they tell you. Okay, well, if you're 125, 130, I don't care. Okay, if you're, less than 180 after meals, okay, great, no problem. There are some doctors that will tell their patients that they're good after meals to be up to 250. On the opposite side, you will have some doctors that tell their patients they want them to be under 160 after eating. You will have some providers that say they want the patient to be under 140 after eating, and you will see some that tell their patients they want them to be 120 or less. And that goes into the next part of what I was going to talk about, is why doctors say different things to different people. Everybody is different and unique. And so we have these groups, these organizations that come out there and they give advice, they give recommendations and say, hey, this is our opinion, and we have, 500 member doctors or 1,000 or 3,500 healthcare professionals or whatever, and they're part of our group, and our group as a whole agrees that this is the thing. And that's kind of understandable on a public health level, a community level, is like a starting point, but it definitely does not apply to each individual person. And so your doctor, when they make these recommendations, when they give you these limits and these parameters, if they are at all even worth their weight in coal, if you can trust them as far as you throw them, if they've had a decent education and they're conscientious providers and doing what they're supposed to do, they're going to look at the whole picture of you. And that whole picture of you, within that, the diagnosis of diabetes is one thing. They're also going to look at your personality traits. Do you seem to have a tendency to worry a lot? Do you seem to be kind of nonchalant and like, I don't care? Do you have a tendency to say, yes, sir, yes, ma'am, I will follow your orders, I will do exactly what you say? They'll also look at your cognitive ability. Do you understand what your diagnosis means? Do you understand what it requires? Do you have the capacity to understand instructions if I was to give them to you? What's your level of understanding? Also, your willingness to do what they say. Like, are you just at the doctor because your spouse drug you there because they said they was leaving you if you didn't go to the doctor because you're sick? Was this a kind of a sudden onset kind of thing, and you're like, okay, you're like gonna take this very seriously? So they're looking at things like that. They're also looking at your finances, and they're looking at your safety, because they have to make sure that if they give you guidance and instructions, that you will be able to safely carry them out. That especially applies to people on insulin. They're gonna want to make sure that you have the ability to understand how to draw up the insulin and how to give it to yourself correctly, or that you have a caregiver that has the ability to do that for you. So, in addition to that, they're going to be looking at your lab results. They're going to be looking at your overall clinical profile. They're going to be asking you questions. They should be, anyway. Not all of them do. But they should be asking you questions about, like, give me a basic idea of what kind of foods you eat. Like, what's your diet? I hate the word diet, but it is what it is. They're going to be wanting to ask you, like, are you going to McDonald's every day? Are you eating salads every day? Are you do you tend to lean toward meat all the time? Do you tend to eat just plants? Like, they should be asking you that. And so they're going to look at that as well, because they're trying to determine what medication strategy would be best for you, if medications are necessary. Sorry, there's a bee flying around. They're going to try to decide which medications might work for you, what dose, how to tell you to take it, when to tell you to come back for checking, how often they think that you should check your blood sugar. Now, as a side note on that, I personally think that people should, especially in the beginning when you're newly diagnosed and you don't know what's going on and you don't exactly know what you're doing yet, you got to be checking your blood sugar before and 2 hours after every meal, because you will never know if your medications or your nutrition changes are working if you're not checking. And you should not have to wait 90 days to get your next A1C to know if those things are working. You can know way sooner than that, okay? Now back to the blood sugar spike thing. When you have a blood sugar spike we're going to draw the line at 40 points, because that's the majority of the medical association saying 40 points or more. When you have that happen, this is a fairly clear, very early indication that whatever it was that you consumed, it could be one specific ingredient, it could be the combination of things together. Whatever it is, your body doesn't like it, or your body just doesn't have the internal manpower to process it all to keep your blood sugar stable. This is something that actually can happen in food sensitivities and allergies. These allergic responses, which I'm going to clarify by saying, a lot of people, when you think allergic response, a lot of people think like a shellfish allergy, like, your lips and eyeballs swell up and like your throat closes and you're like going into anaphylactic shock. That's definitely an allergy thing, obviously. That's the most extreme thing on the spectrum of allergies. Allergies occur on a spectrum. And you can have a low-level allergic response going on that will cause some not very super obvious symptoms. The most obvious symptoms of an allergy is if you eat something or drink something and within 15 to 20 minutes, your nose starts running, you start sneezing, you start feeling like a weird tingly feeling around your lips or in your chin or something like that. That's an indication of a little bit of an allergy response there. Other allergy symptoms include nausea, vomiting, diarrhea, brain fog, blurred vision, migraine headache, neuropathy in your hands and feet, feeling of anxiety, feeling of your heart racing like it's going to pop out of your chest or like it's skipping a beat, feeling dizzy like your blood sugar dropped or your blood pressure dropped. It can also cause your blood sugar to go up. And the reason why is because the allergy part of our immune system has been activated. And we have multiple different parts of our immune system, our different white blood cells. And in the case of these allergy symptoms, we have immunoglobulin E that stimulates our mast cells to release histamine. And when that happens, it activates our immune system to send chemical messengers saying, hey, looks like we're fighting a battle here. We're going to need some glucose. Please give us glucose. So then your other various organs and tissues are going to release glucose directly into your bloodstream. So you might want to be paying attention. If you see blips on your, blood sugar monitoring, or, you've been fine, you've been cruising along for a while, and then you suddenly go up for something, you got to check out what you're putting in. And in the case of my client, this new food that she tried this morning had added casein. And casein is a protein that comes from dairy products. It's found in low to moderate levels in milk, heavy cream, yogurt, ice cream, cheeses, and things like that. For the most part, those are all sort of natural sources. However, there are some people that are sensitive to that. And again, as I said, allergies kind of go on a spectrum where some people, like, if they have one molecule, they're like, gonna die. And if they, have like a certain amount of molecules, they just don't feel well. They feel bad, and the blood sugar's up if they have diabetes, right? In the case of this specific manufactured food item, it had added casein. And this client actually already has a history of some food sensitivities and food allergies. Things like gluten and stuff like that, that we've talked about and sort of narrowed down. And if you're a person that finds that you seem to spike after you drink milk or have yogurt or something like that, that could be the case. Sorry for the loud noise with the truck. If you find yourself going high, having a spike after you drink milk or eat cheese or have ice cream or whatever, then that is certainly a possibility of being a culprit. Okay, so my final point is, what do we do when we have a blip? When we go, boop, uh-oh, what happened here? What my client ended up doing was she decided to drink some water, and she went and took a walk around the block twice. Her sugar went down to 117, and then she went to go play a round of golf and reported that she felt fantastic, but also said, I don't think that this food that I tried today is going to be worth it to eat it again. So the moral of that story is that you might have a blip like that, and you'll call your doctor or something, and your doctor would most likely say, depending on how strict they are with you, don't worry about it. You got to do what you feel is right, and if you're worried about it, got to put your investigator hat on, put your detective hat on, and try to figure out what was a contributing factor. Was it something you ate? An ingredient in that food? Did something stress you out? Like, did you get a stressful phone call? Were you stuck in traffic? Did your kid upset you? Do you have an oncoming infection? You got to think about the different things that could contribute to a thing, but usually it's going to be whatever it is that we're putting in our mouths. We don't want you to be obsessive about, we don't want you checking your blood sugar like 20 times a day, but we definitely, initially, it's a great idea to be checking your blood sugar before and 2 hours after you eat, also first thing in the morning, and also right before bed too, just especially if you're on insulin, just to kind of make sure that we're staying even, and see, you know, what foods affect us in which ways. You know, some foods will raise us, some foods will drop us. We won't know until we start checking and writing everything down. I hope that the information that I provided for you today has been helpful for you, and I reckon that's all I got to say about that, and I will see you guys again soon. I plan on doing many more of these videos in the very not too distant future. So stay tuned, and please be sure, again, to smash the like button if you're on YouTube, comment in the comments below on YouTube, or comment on the Facebook post with this link. And also, if you feel like you're struggling in managing your diabetes and you don't know where to start and you need some coaching, please let me know. Let's have a conversation and see if we'd be a good fit to work together, and I'll be happy to work with you. Okay? On that note, have a wonderful remainder of your Friday. Coach JJ out.